All right, y'all. Well, thanks so much for joining us for today. My name is Jamie Kent here. I'm chair of Smokefree Tennessee and today's moderator for the kickoff to season 3 of our quarterly webinar series, Surviving the Storm: Tobacco Prevention in the Age of Budget Cuts. Before we dive in, I kind of want to just set the stage with a quick lay of the land here, because it's been a whirlwind of a 6 to 9 months for those of us in tobacco control. At the federal level, we've seen enormous change, some of it structural, some financial, and all of it creating uncertainty for our field. The CDC's Office on Smoking and Health, which for decades has been the backbone of prevention work and data collection across the country, was essentially eliminated earlier this year. States and local organizations that rely on its guidance, technical assistance, and grants have ridden quite a roller coaster since then and are still wondering what comes next and where to turn for support in the long term. Over at the FDA, the Center for Tobacco Products had its own upheaval. There were widespread staff cuts earlier this year, including within the enforcement division that oversees youth access and retailer compliance, all while it was supposed to be advancing some of the most consequential rules ever in the field. And then layered all on top of that, we've had federal budget cuts, a government shutdown, frozen contracts, all of which have disrupted communications, slowed down projects, and left a lot of our programs in limbo. So quite the storm, you could say. Shifting priorities, fewer resources, and a lot of uncertainty.
All
But
right, so
we
you
at
don't need me to research
Smoke Free
anything. Sounds
Tennessee
like.
are a hopeful bunch. So that perhaps is also creates a moment for creativity, for collaboration and resilience. And that's what today's conversation is really going to try to be about. We've brought together a fantastic panel of leaders who have each seen these changes from a different vantage point: federal, state, local, and together they'll help us unpack what's happened, what it means, and how we can all move forward together stronger, even in this new environment. So Jeremy, hit the next slide. And while I intro today's panelists, Meg Riordan is Vice President for Research at the Campaign for Tobacco-Free Kids. Meg oversees and coordinates the research department's research translation and policy analysis efforts to further the campaign's policy agenda at both the state and federal levels to expose the tactics of the tobacco industry. Now in her 23rd year at the campaign, Meg also continues to provide support and technical assistance to campaign staff and states to help them successfully incorporate research into their issue advocacy campaigns. Meg received a Bachelor of Arts from Brown University and a Master of Public Health and Health Policy from the University of Michigan. Michael Tynan is the Senior Advisor for State and Local Tobacco Initiatives at the CDC Foundation. Michael previously served for 14 years as a public health analyst and policy team lead in the Office of Smoking and Health at the CDC. While at CDC OSH, Michael worked closely with states, communities, and national organizations on a wide range of tobacco control issues, including tobacco pricing, flavor restrictions, smoke-free environments, depictions of tobacco in popular media, and the overlap of cannabis and tobacco regulation. Michael also previously worked as the policy director for the Oregon Public Health Division, where his work included developing public health rules for cannabis legislation. Throughout his career, he has regularly advised policymakers, state officials, and advocacy organizations on complex health policy and media issues. Michael lives in Portland, Oregon, with his wife and 2 children who are both in high school. And finally, Liz Johnson serves as the Director of Tobacco Use Prevention and Control Program here in Tennessee at the Department of Health, a role she's held since 2018. She leads statewide efforts to prevent and reduce commercial tobacco and vape use among youth and adults, with a focus on addressing disproportionate burdens in high-risk communities and the rise in youth vaping. In addition to her state role, Liz has served 2 terms as the Southeastern State's regional representative for the Tobacco Control Network and is the newly elected Member Engagement Officer, where she leads member engagement activities, including programming events, coordinating surveys, maintaining the peer mentor program, and addressing member challenges. Prior to this role, Liz was the executive director at the Sumner County Anti-Drug Coalition, served as the program coordinator for the Regional Intervention Program in Franklin, and taught elementary school here where I live, also in Hendersonville, Tennessee. Speaking of Liz, I'm excited to pass the mic to her next for today's spotlight session. As y'all know, or for those that are new, each time in our webinar, we like to kick things off with a spotlight session, highlighting some great work that's happening locally. Knowing the subject of today's conversation and the fact that Liz has been steering this ship locally in the work statewide for quite some time, we thought it might be especially helpful to everyone to get the inside scoop from her on how all things Tennessee has been. It's been, I guess, what it's been like riding this roller coaster here in Tennessee and surviving this storm. So take it away, Liz. The mic is yours, and thanks again, everybody.
Thanks, Jamie. I am glad to be here with you all. Wish we were talking about having some happier conversations. But Jamie asked me to kind of level set and let you all sort of in on, and many of you that I've spoken with and worked with over the last 9 months have some inkling of how hard it's been. It has been hard is an understatement. I have other choice words that I will not share in mixed company. This is also being recorded, and I actually very much like my job, so I will not be elaborating there. But yeah, there's the hard. We've been through a lot with this program, a lot of changes and ups and downs, and I can honestly say this is the hardest year I've ever experienced in this position. And I'm not going anywhere. They're gonna have to walk me out. So with the uncertainty of our federal funding, we really did create several different contingency plans. And I know that many other states, and really I'm very connected with the Tobacco Control Network, which has been a blessing. And I've been able to work closely with other states to figure out what's going on and what our plan is to move forward. Unfortunately, in July, we at the start of the fiscal year, when we had no word on what our federal funding was going to look like, we had to eliminate some state positions that were federally funded. It was devastating, and we were able to maintain 3 state positions on top of some regional staff that we funded with our CDC grant that we're able to really backfill with our state money. So we were able to keep some staff, and then we were also able to maintain level funding with all of our metro health departments so they could retain staff and continue their tobacco work. At this point, we are very lucky. I have many state colleagues that I've talked with who are not in the same boat that we are. Oddly enough, this program has received more state money than we ever have this year in the time that I've been here in the past 7 years. So while we lost our federal funding, and then it's back, I will say it is back. So we have received our federal cooperative agreement through April of 2026. That's been challenging too, though, trying to navigate how to get those dollars out the door, especially with the government shutdown at this point, and trying to navigate that. I won't go into a whole lot of other detail right now, but we're in a different position than some other states. We did receive I'll just give a little bit of an update on sort of what our funding looks like, if that's okay, Jamie. We did receive a one-time non-recurring allocation of $2.5 million to really focus on cessation work, and our department's the second priority for the department is to request is to make that funding also recurring, along with the state funding that we do receive from the legislature. This is also our first year with our dual settlement funding. It's very prescriptive and very the proposal that we gave to the Attorney General's office. It's very prescriptive, but it is supporting all of our youth prevention work, and so we're very lucky to have that as well. We have a bit of carry forward from previous years that we were able to roll ahead, and so we're able to maintain our quitline and other contracts. At this point, the biggest hit was really our state employees that we lost, and luckily, a couple of those folks were able to take other positions within the division, and then one at another health department. And so I feel very, I'm devastated to have lost them. They were true assets to our team, but they, have some stability, I think, at this point. I will just say the one concern, I'll kind of close with this and then turn it back over to you, Jamie. The biggest concern that I have at this point is really sustainability of programs and contracts. Our federal money gave us some flexibility, and I say that there are a lot of things we can and cannot do with that federal money. However, if there is no additional federal money coming from CDC OSH, whether it looks like a block grant or something else, some other option coming from the federal government, when that money ends, um, and if this $2.5 million does not become recurring, there's some major concern about sustaining our programs and continuing to do the work that at the level that we are currently expanding. And we're rapidly expanding, which is not many states are able to expand right now. They're really having to cut. They're cutting media. They're reducing their quitline services, and so we have not felt that at this point. And I'm very lucky to be able to say that. But so sustainability is certainly a big concern, and so I think that's where I'm at right now. Is lucky, but also lots of concern, and it's not over. And so I'm excited. Excited. I'm looking forward to hearing from Michael and Meg about what they know and kind of help plan for the future if there is a way to do that. So I'll stop and turn it back over to you, Jamie.
Awesome. Thanks, Liz. Thanks for your leadership in this uncertain times. It's we're so lucky in Tennessee to have a leader like you in the program that's keeping this ship moving forward. And I think the fact that we are in the position we are is a testament to that. So thank you for that. All right, so it is officially panel time. We're going to welcome Meg and Michael into the conversation. I'm going to pose some questions. I'll direct them to y'all, but ideally would love y'all to all answer them from different frames and perspectives. And I'll start with really behind the scenes. The past 6-9 months have been turbulent, as we've all discussed, especially at the federal level. And from your perspective, what were the key moments or decisions behind the scenes that have shaped where we are today? And what's the lessons should states and local governments take away from how it's all unfolded? Kind of give us the inside scoop of how it's gone down in the past, but how we're looking forward. And Michael, I'll start with you on that front since you were
Yeah,
really
thank
in.
yeah, thanks, Jamie. And I should have included in my bio that my sister lives in Chattanooga and my brother-in-law lives in Murfreesboro, and I grew up in Lake Cumberland in Kentucky. So I'm very familiar with this region and spend a lot of summers with my sister and her family in Tennessee. So I'm very familiar with your state. So I mean, I think a key moment was, and Liz has already referenced this, and so did you, Jamie, was when the Office on Smoking and Health was eliminated on April 1st. And so there are a lot of challenges with that because OSH really led three important national initiatives. So there's the funding of every state health department. There's the conduction of national surveillance and evaluation that was done, and then there was the Tips from Former Smokers campaign. And so if we drill down on the state funding, because I think that's what's most impactful for folks, it's really important to realize that it's that sustainability, the funding for cessation that Liz mentioned that is going away. I mean, it means that OSH and CDC and the federal government funded every state to run an evidence-based tobacco control program. And these monies, when combined with state dollars, funded surveillance, evaluation, cessation, and policy work that we know is effective at eliminating adult and youth tobacco use, including e-cigarette use and pouch use that's growing in states. So moving forward, there's going to be challenges. Like I think one of the things that happened behind the scenes is that we're really lucky that amidst the chaos, we were able, like there was an effort among the people who were left, who were in the process of retiring, who were left behind between April 1st and April 30th to get the money set up to be put out the door. And it really felt like Lucy with a football there for a while toward the end of the federal fiscal year. But we were really fortunate that before the government shut down, that the money that would have normally gone to the National Tobacco Control Program, so state health departments, did still go out the door. But there are challenges with that, right? Like states have less than a year to spend a year's worth of funding. There are many states that have issues spending the money on time sometimes because of contractual problems that they have in their state or just the red tape that they have in their states, to speak plainly. And they would rely on what are called no-cost extensions so that they would have more time after April to spend the money. I don't know that states are going to have that flexibility moving forward. So states are in a crunch to spend money as quickly as possible. Every state also didn't apply for the continuation. So some states did not receive tobacco money from the Office on Smoking and Health in this last year of the FOA. So that's challenging. I think we are moving into a universe where we used to have every state had a tobacco control program and every state had a quit line. that is most certainly a time of the past. We are moving into a period where, looking into 2026 and beyond, every state will not have a tobacco control program because states aren't fortunate, like we just heard from Liz in Tennessee, for the state to put some state dollars in it. There are some states that all of the resources they relied on were the federal monies, or it was so much of it that with the federal money gone, they can't maintain a program. So I'm very worried about quit lines being gone. So what are we going to do in the next 4 or 5 years, as we look at what this new period looks like without a new influx of federal monies coming out? I mean, we could be looking at a time period where 10 to 15 states don't have tobacco control programs, or have no quit line, or quit line with severely reduced services. And we're going to be doing this in an environment with no tips from former smokers campaign, and a reduction in surveillance. It looks like a lot the NYTS is going to continue going into at least 2026. I don't know what the future looks like for that. And when I've seen charts and I've talked with colleagues about all of the national surveillance, I can't tell you how many times I was in meetings over the years protecting the tobacco questions on the BRFSS or the YRBS. Who's gonna do that now? Like, when there, and it wasn't just me, it was me and my colleagues, but who's going to be there now to advocate for the tobacco questions on national surveys? And so these are the things that I worry about. And so, and then, what is I mean, we could talk about like what this looks like moving forward. I'll hold off, Jamie, but I mean, I think, why did this happen? Like, where are we at? Like, it didn't happen to save money. I will tell you that. Like, for every $3,800 we spent on the TIPS campaign, we prevented a death. And from 2012 to 2018, the TIPS campaign cost about $500 million and prevented 129,000 early deaths and saved $7.3 billion. So that's a 15-to-1 return on investment. So, contrary to the narrative in the national media about this was done to save tax dollars, like, the Tips from Former Smokers campaign, the Awesome Smoking and Health, the work that we put out into states was cost effective and it had a positive return on investment. So, um, you know, I think we were targeted because we were effective. I think this work was targeted because we were highlighting the harms of e-cigarettes to youth. We were highlighting the growing dangers of pouch use. And I mean, big tobacco is they won this battle, and so hopefully they don't win the war. So, that's sort of, I'll stop.
Thanks, Michael. That's eye-opening and disheartening all at once, but also encouraging, knowing that the work is so effective and that if we can find a way to continue funding it, that it does save lives, right? And I think you mentioned big tobacco winning this particular battle. It struck me as eye-opening to learn that the chief of staff in the White House was a former tobacco lobbyist, and that's never a good thing.
And you could
Um,
also look at there's media reports today about donations for ballrooms that include RJ Reynolds and Altria.
Yeah, yeah. All right, Meg, I'm gonna kick it to you then with this same question, maybe a slightly different frame, but I'd love to get your perspective on it.
Yeah, thanks. I mean, definitely agree with Michael and Liz's comments. There's no question that efforts to reduce tobacco use across the country have been severely undermined, right? With the elimination of OSH and just the administration's perspective on public health that, we've been hearing day in and day out over the last several months. It's very problematic. It's worrisome that OSH isn't there. Questions about science and research and just really the devaluing of that. That's all great concern. I will say I've been encouraged though, right, by leaders like Liz, like hearing about Tennessee, what you've been able to do, how states like Tennessee and states who might be in a little bit tighter spot than Tennessee might be right now, how they've been able to pivot and be creative. And I think we're seeing examples of that from states, just really people kind of stepping up, program managers and others, just really being creative and thinking and working with one another, communicating with one another. I think the Tobacco Control Network that Liz mentioned, the state program leaders that help run that, I think have really been doing a great job in terms of sharing information, raising questions, trying to pivot and help. So that's all I think positive. I want to raise those folks up. I think that there's no doubt it was great news to have the money go out, right, to states it went out the last week of the federal year, right? Obviously not what we wanted to see happen. I think it's, strong advocates that were left within the agency helped with that. I think advocates outside of the agency and voices from the states and communities really sharing, putting some pressure on members of Congress, letting them know about the programs, about OSH, about why it's important. There's a constituency that cares about it. I think that all sort of helped dislodge those dollars. And I think, thanks to folks on the call and folks from around the country, when national partners asked for information about concrete information about the impacts of this in your state, human interest stories about, people who would no longer call the quit line, or how, real examples of how people in the states were impacted. I mean, we use that at the national level as we went in dozens and dozens of meetings with members of Congress. Those were the types of information that we collected from you all and that we put to use, and I think really helped make a difference. But now we're pivoting to FY26. That was FY25 dollars that went out. And we're taking it to Congress. It's Congress that has a role to play here in terms of determining how federal dollars should be spent, right? And so we're focusing a lot of attention on appropriators, both in the House and the Senate, to make sure that they understand the value of CDC, value of CDC's Office on Smoking and Health, the value of the state grants and the state programs that utilize those state grants from CDC. And just real quickly, where we are now, so folks know, is that Congress writes appropriations bills every year, right? There's a House version, there's a Senate version. We've seen those versions. A big test that we were looking at early on, and if you've probably heard this on other calls, were those bills going to reflect the administration's reorganization of HHS? Were they going to just go along with the elimination of, Office on Smoking and Health, CDC, just the total reorg of HHS? We were waiting to see. And the good news is they did not. Both the House and the Senate did not go along with the HHS reorg. They both included funding for CDC, albeit at a lower level. They both included funding for CDC's chronic disease programs. The Senate bill actually included level funding for the Office on Smoking and Health at $246 million, while the House bill zeroed OSH out. And that, to say that's not new. The House has zeroed OSH out for the past several years, right? So that's not like something new that's happening reflecting the administration. That's just what the House has done. And then what happens is the differences need to get resolved in conferences. And so a key decision will be for legislators. Are they going to restore OSH? Are they going to put federal dollars to tobacco prevention, if not OSH? So we'll continue to advocate for the Senate approved level funding for OSH. Again, that's where the state information, the state stories, the state data really come into play and help us make the case for OSH. I don't want to sugarcoat it. It is going to be an uphill battle, an uphill fight. But we're going to take it to them and put pressure on where we can. We do have some strong allies in Congress who care about tobacco, who care about OSH. And so we're just going to, continue to push Congress to assert its role and make the case, right? That's what we do. That's what we can do. And I think lessons learned real quick, I'll wrap up, Jamie, is that it's really important to have as many voices as possible. We in DC make the case, but having people back home in states across the country, talking to members of Congress, talking to other community leaders, talking to the health department leadership, just really making the case for tobacco prevention, why it's important and what happens, what are the risks if dollars and funding goes away. And I will just share one specific example that I think was really impactful. We had Liz, I don't know if you know Crystal Dent from Utah. She's the Utah Tobacco Control Manager, but she actually got together with some advocates in the state. This summer, she attended a policy roundtable with Representative Malloy from Utah, who's on the House Appropriations Committee. really and just talked about the program, right? She put faces on the program. She talked about the work that she and her colleagues do, and um, the advocates were with her. And I think they just made a very compelling case, um, sharing firsthand about the program and what the loss of funds would mean to them. And so I just encourage folks to think about that, doing that kind of work, because we do need as many voices to keep the pressure on.
Thanks, Meg. That's great. And that's a you sort of segued naturally into my second question here, which is sort of what does advocacy look like in this new environment? Um, so Liz and Michael, I'd love for you to build on that too. What can cities, organizations, coalitions, advocates do in this new environment to strengthen our advocacy and fight in the most efficient way? Should it be directing it towards the federal level? Should we be directing it to our state legislators? Should we just be doing the good work so that y'all can have the tools to go and advocate? But would love to get your thought on that. Liz, I'll kick it to you first.
Sure. I think from the state standpoint, continuing to support our coalition and spreading the message of the work of the coalition and lifting, I think that has been the greatest investment that this program has had in a lot of years is investing in our coalition and making sure that we have a strong group of partners that and Jamie, you are our fearless leader. They're getting people together, hosting webinars, whether it be 50 people or 100 people that show up, and hosting quarterly coalition meetings, and just making sure that this is still top of mind for people. Allowing me to talk about our funding in a way that, and letting people know that because there are still a lot of folks who don't know what has happened, all the details. I feel like just because we've been living in it for the last 9 months, they don't get it. I mean, I'm constantly educating my friends and my neighbors and people around me. And one thing that we are doing is we are focused heavily on media promotion with the Loss of Tips campaign, and really just we're going to be spending a lot of our funding over the next year on not just cessation to kind of cover, because we'll never be able to cover the gap of tips ever, ever, ever. Developing some other, pulling down some content from MC&RC that we were able to that was saved and sort of able to be recovered. But really just making it known that we're here still and we're still doing this work, and really also leaving a lot of the hard work to our coalition, who can do things that we cannot do as members of the state government. Um, I'll stop there and let Michael share anything else.
I'll say that I defer to Meg and the advocates on the strategy piece that you asked the question of. But what I will say is it's critical to make sure that you have coalitions that have voices that represent your community. Like the most effective efforts, in my experience, are the ones that look like their community. So the coalitions that actually represent the community. And don't let tobacco companies fill the void, right? Don't let the tobacco industry front groups like Global Action on Smoking and Health and others come in and fill the void with their funding. Tennessee's a great example of a state that shifted the narrative on preemption, right? Like prior to your preemption repeal, like I think a lot of people in tobacco prevention were pretty sour on were preemption campaigns worth it. You may probably have even been told your campaign was a lost cause. And because it felt nearly impossible to repeal preemption for smoke-free, and you did it. And you did it because you had authentic voices that represented your community. And that's where the power is. The power is with the local people who live in your community. And so like they can't that can't change, right? Like, we talked, my whole last question was about the elimination from the top down. They can't eliminate the work from the bottom up, right? And that's where we know where the power really lies.
I'll
That's
just
And I'll
say
just say the
I
tobacco industry knows it too, right?
They
They're
do.
afraid of
they
the
sure
the
do.
people at the local level. Yeah.
They sure do. I was very skeptical of Jamie and his mission to repeal preemption and smoke free. And it took me a couple of years to really, we were like, who's this new guy coming in here? He does not know how hard it is to repeal preemption. And look at him go. And he's still here. And this is why, yeah, he's our band leader, literally. So
Meg, anything else you want to add to that from all, things advocates can be doing to strengthen their stance here in this time?
Yeah, I mean, just a couple things. Couple is sort of echoing what Liz and Michael have already said, but I do think I love to hear about the advocates in the program, folks working together. I mean, it's just critical to work together. We know, and Liz mentioned this, state programs, government employees are sometimes, strapped in terms of what they can say. And so having those relationships, so Liz might have the information and the data, the people to some extent, but it's the advocates who can really put all of that to work and do the direct lobbying and do the hard messaging that Liz and her team can't do. And so really encourage you to work together and looking to maintain and strengthen the coalition. I think you started off, Jamie, by talking about being creative in this time, thinking outside the box about who might new partners be on various initiatives or within the coalition. We're doing that at the national level, like they might seem like strange bedfellows, but if they are going to help us move a particular policy or help us, they might be the right messengers for a particular message we want to use, or a particular legislator we want to impact, figuring out what are some of the, whether it be individuals, grass tops or people, organizations that might help you advance your goals. And then, just don't be on the defense, be on the offense, right? In terms of uh, proactively going out there, putting a spotlight on the problem, on the solutions, on the industry, right? The industry is they are the cause of this problem, right? This tremendous suffering, death, disease, high healthcare costs. It is the industry that is like, they are not part of the solution, even though we're hearing more and more of them put themselves out there as that. I'm sure you're hearing that, worried about that in Tennessee. So what you can do to shine a spotlight on the industry, its marketing practices, its opposition to policies that we know work. They're all about maximizing their profit, regardless of what they say. They are about expanding their base of customers to maximize profit. So to the extent that you can socialize that and make people understand, and that's why it's so important. I mean, I think the programs, I think OSH, you know, they're our best defense against the industry, right? That is constantly out there pushing their messages. So I think I'll leave it there.
That's awesome. Thank you so much. Great points and inspiring ideas here for advocates like us on the ground as we think. And we're already thinking about how to play offense next session here in Tennessee around tobacco retail license. So we're excited to keep that good work and keep the gas pedal down, pushing forward here. Thinking about filling some of these gaps left by the federal dollars that have disappeared, the resources like publications and technical assistance that are disappearing, data becoming harder to access. Where do you see organizations and advocates turning next, whether it's for funding or guidance or evidence-based tools to keep the work going? What's out there currently? Where can people look? Michael, I'll kick it to you on that one. So.
Yeah, I mean, I think the funding piece is going to be really hard, right? Because no national organization will or can fill the gap left by the $250 million budget hole that is being eliminated with OSH. And I think some people, me included, would argue no national organization should fill that gap, right? That is an appropriate role for the federal government to play, right? And so, but what I do know is that nonprofit organizations and non-government organizations have always been a part of this movement, right? So Meg from Tobacco Free Kids, people from Heart, Lung, and Cancer, state health foundations, Americans Non-Smokers' Rights, the Public Health Law Center, all those organizations are still going to exist and be able to support those ground efforts that are continuing. And so those organizations will continue to fight. And yeah, I think Jamie, you brought up accessing information. I am worried about what maybe not in 2026, but further down the road, what do surveys look like nationally, and how are we going to get that information? Is it going to come out in a timely as a process? But what we know about the evidence base is true, right? Just like how germ theory is solid and the science about vaccine efficacy doesn't change, no matter how much you say otherwise, the science doesn't change. The same is true about what we know about tobacco prevention, right? We know it works. This will not change, right? Tax increases, smoke-free laws, flavor bans to reduce youth interest in these products. We know these policies work. We know they prevent adult smoking. We know they prevent quit. They prevent youth from starting. Uh, the good news is that our goals will remain the same. I think the challenges with dwindling cessation resources are real, though, especially from state health departments. We might need to look to insurance companies or healthcare providers or hospital systems to close some of these cessation gaps and realize that they are also facing, federal financial pressures as well. So I don't think I have a good answer, but, I think we're going to try to have to figure it out together.
Yeah, that's a great point. And, as we think about the new partners and, folks in this fight together, but from different perspectives, some of those are great. And yeah, I will give another shout out to the A&R Foundation too some of those resources, because they're the ones who initially got in contact with me many years ago and uh, opened my eyes to this movement and helped train me to build a coalition. So there's resources that are out there for folks like that, and I just want to make sure folks realize that too. Meg, any places you can think of that where folks will be able to find publications or technical assistance or things like that as well as they disappear? Or
Yeah, it's a good question. It's one that I know the national partners we've been meeting and grappling with for the past several months. I mean, I think, you know, the Tobacco Control Network, the TCN, I think TFK supports them. I think they're a great resource. We're starting to kind of um, uh, looking to be more proactive in sharing materials with the TCN and with the broader field. I think a lot of people know of TFK's resources and materials about information we have online. There's a lot of stuff that we do in-house, right? That we share with our state team and others that we're thinking about how can we be more proactive in getting that information out there to folks. Like recently we just disseminated some new stuff on nicotine. As we see more messages about nicotine isn't that bad and nicotine can actually be helpful. There's benefits to nicotine. We put some resources out on that, resources out on nicotine pouches. But and we're going to continue to do that, right? I don't think we've done enough of that. We want to do more of that. And I'll just say put a plug out for you, you know, uh, as there are needs. I think the national partners, we're talking with one another, with CDC Foundation and others about, if you need information on X or Y, I think making us aware of that, and then we can talk to each other, figure out who's in the best spot to help fulfill that need, right? You know, I don't know that we have a full idea of how it's going to take shape, but I think it'll start to take shape as we get. I'll be the first one to say, and I don't feel like I have my finger on the pulse on like what all the needs are in terms of like what, and they may be differ, right, across states and regions. But even if it's trickling it up through TCN, if it's reaching out to your state, Rad from TFK reaching out to me or Michael, I think we all are in a spot where we want to be helpful and we want to figure out how we can be most helpful. So help us figure that out. Just let us know. It goes back to just communicating more, I think.
That's great. That's great. And I think coalitions like us and states like leaders like Liz we can put out maybe surveys or really try to, I mean, I think we know generally pulses, but yeah, I think as some of the, like, what are they really missing now that stuff has disappeared, and where can people step up? Liz, what you mentioned, TDH investing more in media to try to fill some of
Mm,
the gaps of the tips campaign. You
mhm.
want to talk about that a little bit more too? Because I feel like there's a really interesting opportunity for folks to be
Yeah.
able to tap into or maybe share that media or spread
Yep.
it.
Yeah, for sure. We those of you who don't know, CDC has had for years the Media Campaign Resource Center. That was a wealth of, I mean, just wonderful free resources or low cost resources for media. And the fear was that that was going to be whisked away and we would never be able to access it again. And so, as Michael mentioned earlier on, there were some folks from CDC OSH that before they retired, they kind of found some places for these things to live, and so it's been helpful. Our health comms specialist on our team has been able to pull down some materials and get some things that will get out. And I think that's one big piece of our strategy is really media and messaging. Another thing that I wanted to just mention, and that really, I think we are more than happy to share, and we're going to have social media campaigns and streaming in different places to reach all of the populations. But and certainly I could put a plug in for Erica to be able to connect with her if you're interested in any of the media connection or the media assets and collateral that will be developed or that we're using. The other thing that we've not ever done in the state of Tennessee is an ROI for our quit line, and we're going to be working with. It's still early stages in academic and state academic institution in Tennessee for that purpose. Michael mentioned maybe tapping into healthcare systems, which our rural healthcare systems are struggling like the rest around the country. However, we may revisit. I was part of the 618 project back in 2018, and that didn't go well for us. But I'm not opposed to going back and revisiting and doing some of that work again. But I think an ROI there. We're also looking at an ROI for our pregnancy smoking cessation program, and then maybe broader overall program ROI. But those projects, at least the Quitline ROI, that we've got some templates from other states who have done this work before, and we just have never done it. And I think that will be really important to be able to show the impact and the investment that and the money saved by using the Quitline. I think it's going to be crucially important right now to our state legislature, who continues to fund it, but we need them to continue to fund our Quitline for now. Hopefully, one day down the road, we'll be able to. I don't know. I'll stop there, but I think those are some of the things that that we're excited to be able to do, and yeah, some different projects happening.
I love that. I think those are brilliant things to undertake, and you mentioned this, things that we can use to advocate for continued funding from the state, so that it doesn't just stay as one-time funding and turns into recurring funding. And I think that's a really interesting point too. Of a lot of the federal dialogue has been return power to the states, in various forms and formats. So, and states want that, at least states like Tennessee. So in that case, then they also need to step up and fill those funding gaps as well. So I think that's, it's important for us to message what's disappeared and where they need to step up, because, frankly, states like Tennessee have been collecting lots and lots of money from tobacco taxes for decades now, and it doesn't necessarily go into these programs, right? It just goes back to the general fund. So maybe now is the time and the case to make that towards us. Also want to flag that our coalition has a resource page with some social media and videos, and these webinars live on that page. So, maybe it makes sense too for us to join forces with Erica in your office and house some of those tips, campaigns, and resources on there for coalition members to log on to, grab if they want to use it anytime. But I think that's a role the coalition could play in that too. I'm gonna go to the chat here for probably our last question, because love to get audience participation in here. And Brad Wellens had a great question here for all the panelists. Are there some particular emerging issues that seem to be gaining more support for increased funds or programmatic attention that you're seeing we can maybe highlight in our local advocacy and maybe give more weight to on the programmatic side? One example he can think of here locally has been zoning and tobacco retail restriction efforts in New Orleans. But are there any others that you're seeing? Meg, I'll maybe kick it to you first.
Oh yeah, I'm right. It's a great question. I think it's focused on what's resonating with legislators, or is that what it was focused on?
Yeah, or
Local
what
address.
yeah, what
Yeah,
other
I mean, I can tell you what we've been focused on. Really, I think love to hear, Liz, about the ROI for the quit lines. I mean, that stuff is gold, being able to show that there's a return on investment being able to document actually, like, I kind of mentioned this earlier, specific examples of how the funds are being used, and the ways that seem to resonate are, helping people quit, right? And quit lines are the best, most concrete example of that. People get that. They might know people in their community. They might have a family member who needs help quitting, and the quit line is something easy to understand. Um, I think that the addiction angle, how incredibly addictive some of the newer products have become, the high levels of nicotine, the fact that youth are using multiple products, the risks that are posed from high levels of nicotine. I mean, I think that just, like, think about it, right? Those are compelling messages. Like, if you think about how the kid, when you think years ago when Juul first came out, all of those stories about, oh my God, I can't stop. I need to find my next one. While those have sort of, we don't see stories like that anymore as much. I do think that idea about how incredibly addictive and how quickly young people can become addicted to these products resonates. This on the federal level, I don't know if this really resonates locally, but we've heard the administration talk about chronic disease, and they supposedly care about chronic disease. So we are, always talking about making the link. We think it's obvious tobacco use is the primary driver of many, serious and costly tobacco diseases, heart disease, lung disease, cancer. But, it's just making that link, making that connection, driving down healthcare costs. If we want to be serious about driving down healthcare costs, you need to drive down, one of the largest drivers of those costs. So those are a few of the messages and topics that we tend to cover.
Yeah, I mean, I think to build, I mean, I defer to the advocates and Meg on what the strategies are to highlight. And I agree with everything that she said. I also think that, something that this is building on something Meg said, something that we always found at CDC that when I was at CDC, was that the new and emerging products really resonated with communities and with lawmakers. And so that product for me right now is the nicotine pouch product, right? That was the product that I was seeing. That was the product class that I was seeing, that we were seeing, that was growing, and the data were showing us that they were growing among interest among young adults and youth. So I would pay attention to the data that do come out about nicotine pouches and ask questions about where's information available. There's still information available on OSHA's old website. The CDC Foundation does have data as a part of a project that we use where we look at sales data for e-cigarettes, and we're adding we've added nicotine pouches to that. So I would pay attention to the nicotine pouch data, though. It appears to me that that's where the tobacco industry is making a lot of noise, and I think we can pay attention to when the tobacco industry starts making noise about these are the kinds of products that we need to make sure get legally into the hands of adults. That's the way that they talk about it. And what I hear is, and by the way, a bunch of kids are going to start using these products too. So I think we need to definitely pay attention to nicotine pouches as well as, um, again, we know it works. We have ample examples from hundreds of cities in the state of California, the state of Massachusetts, and the entire country of Canada that have banned flavored tobacco products and menthol. And we know it helps adults quit. We know it prevents youth from starting. And we know that all of the tobacco industry's claims about the evils that banning products will do, about black markets and people driving across borders, they're overstated. They don't happen at a population-wide level. Most smokers want to quit. More than half try each year. It's our job to help them like get to the resources that'll help them quit. And so I think it's combining all of that. It's explaining to people why the cessation services need to be there and be available, how we can get new partners to the table to help support some of those efforts, and then also paying attention to where the industry is putting their resources and emphasis, and that's in the electronic products and the pouches.
Can I just add one thing? I totally agree on the pouches, Michael. And one, the rates are still pretty low. So just a couple of tips, instead of focusing on the rates, we've been focused on the numbers of youth, right? I think it's like 500,000 youth use nicotine pouches. That's more than double a few years ago. So that is just more impactful than saying like 2%, right?
Yeah.
Or whatever it is. I don't know
Yeah.
it off the top of my head. But then also, when it comes to things like pouches and risk to young people, this goes back to my points earlier about the coalition members and broadening the coalition, and they're probably already part of your coalition, but telling the story, nurse practitioner, school nurses, educators, school principals, right? Educator groups are part of our national coalition, and they've been really helpful and effective in helping us tell the story about concerns around pouch use, right? They tell from the front lines of school nurses, secondary school principals, PTA. Those are all effective messengers and really can tell compelling stories on these issues.
Absolutely.
Fantastic. Liz, do you have anything to add there? Or
I don't think so.
awesome. Well, that was a great question, great answers. I want to thank all of y'all for your amazing wisdom and sharing your time and energy and insight with us today. A round of applause, Michael, Meg, Liz, all of y'all. We are so grateful to you. Jeremy, I might have you share. We just got a few housekeeping items to run by everybody to make sure you're aware. But our next webinar will be January 22nd, 2026. Who, what, where, the case for tobacco retail licensure in Tennessee. We're going to get in on that and really dig in on what we're going to be, this is the coalition's #1 policy priority next year. So help us dig in on that. Our next coalition meeting is going to be November 18th. We are still looking for a home for it, and we would love to bring it to your city. So reach out if you want to host us in your city or county for the last one of the year. Quick reminders: we get you do qualify for certified prevention specialist certificate for this, or CEU credits for this. We're going to send out the presentation in Zoom and some follow-up assets from Liz, Meg, and Michael next week in our newsletter. And we'd welcome any of y'all, if you're new to, you're just tuning in for the first time, welcome you to join our coalition, join a committee, get in on this work. We're doing the work on the ground, and we'd love for you to be a part of it. And don't forget, smokefreetennessee.com/resources has a bunch of free stuff for you. If you want to get involved, that's our email. And really, thank you again. Shout out to Jeremy working the slides and the tech for us, our coalition coordinator. And thanks again to Liz, Meg, and Michael for joining us today, and everybody for being a part of this, tuning in the conversation. Our next coalition meeting, I see in the chat, November 18th. It's a Tuesday, I believe. So we'll see you then. We are grateful for everybody's work and advocacy and time. And here's to a smoke-free Tennessee.
Thanks, Jamie.
Thanks, everybody.
Thank you.
Thanks so much.